I will be introducing Mrs. Debbie Dobbs. All right. Debbie Dobbs is a leading expert in Katie Beckett Medicaid and special education advocacy. Drawing from both professional experience and personal journey, Debbie has spent the past 18 years guiding families through the Katie Beckett deeming waiver process, equipping them with the tools and information needed to access critical services and supports. As the founder of Debbie Dobbs Advocacy, she has helped thousands of families across Georgia navigate Medicaid systems, secure educational services, and connect with vital community resources. Debbie provides one-on-one guidance to families navigating the Katie Beckett application process, as well as other funding options, helping them understand eligibility requirements and successfully access available supports. She also assists parents seeking help with special education issues, including eligibility, IEPs, 504 plans, and behavior planning. Her background includes a 20-year career in healthcare management and advanced advocacy training through the Georgia Advocacy Office, Rights Law, COPA, and William and Mary Law School. Through her workshops, individualized consultations, and statewide presentations, Debbie is committed to helping families understand their rights and advocate effectively for their children. Everyone, please give Mrs. Debbie Dobbs a warm welcome.
Thank you. So I, like Dr. Call, have a lot to go over today. I was a little overzealous with how much information I want to share. I encourage everybody to go to my website. I have lots of free resources, and there's a ton of information on there for you. I want to make sure that I tell you, I'm not a doctor. I'm not an attorney. So if you need some questions about any of those things, I can point you in the right direction. And everything that I know today is present as I know it as of today. So why am I here? This is my kiddo. Shortly after being born, I got what I call a lovely loud silence, and this is the process of him being intubated. He was diagnosed on the autism spectrum around 4 years of age. I also had to go through navigating, where do we go? How do we navigate wait lists? How do we get that initial diagnosis? He has other medical conditions going on as well, and is now an adult. So a little bit about me. As she mentioned earlier, I've worked, thank goodness, managing medical practices, because as a parent with a kiddo on the spectrum and other medical issues, it's been really hard to know, where do I go? How do I get things paid for? I'm so thankful I had that background. I had a lot of advocacy training through various organizations. I'm passionate about speaking to parents and making sure that you know what resources are available. A long time I did a talk, and the parent was a child, and she was 18. And she says, well, can I apply for Katie Beckett? I said, well, at 18, she needs to apply for SSI. She said, well, I was told we make too much money for Katie Beckett. I said, oh my gosh, this was a family who is kind of barely making ends meet. And they totally would have qualified, but she was never able to receive any services outside of what she got in the school system. Was complicated, needed a lot of services, and never was able to get them because the family didn't understand the process and didn't understand where to look for resources. So that's been my passion, in ensuring that families understand where to access resources. I run an autism support group. I love volunteering. I was a big brother, big sister for over 12 years. She's now an adult and has kids of her own, so I feel really old. All right. So what are we going to talk about today? Who's eligible? What's Katie Beckett? How does it work? the application and the renewal process, common pitfalls, tips, and other funding opportunities. Like I said, this is a lot of information, so I'm going to talk fast, and it's overwhelming. And as I mentioned, I do have free resources on my website. Like, this could be a 3-hour talk. But I'm like, I want people to remember that there's something out there, and know that you can find and access that at a later point in time. So Katie is a real person. She passed away in 2012. During the Reagan administration, her families advocated because they wanted to have her be able to be at home and have services. And the only way at that point in time was for her to live and be in an institution. So they lobbied, and they got the TEFRA Act passed through to their advocacy efforts. And what that means is that families who have income and assets above the SSI limits, so you have to have means above where you would be eligible for SSI, based off of their disability, they can receive Medicaid. When most people hear about Medicaid, you're hearing about it due to lower income categories. That's not Katie Beckett Medicaid or the TEFRA Act. Not every state participates in it. All right. I don't know a single family whose child has gotten a diagnosis or looking to get a diagnosis, and they say, you need to apply for Katie Beckett, and they're not feeling like this guy right here. They're like, what is all this paper? What do I have to do? This is a lot of stuff. I don't even know where to start. And frankly, most families that I've dealt with are really understanding that this isn't what I thought, and what is our new reality, and what is this going to mean like for our future, and how does this impact us? I mean, I know what it was like for us, little, in terms of play dates or lack of play dates or other different things, going out and about into the community. So there is this period of mourning that many families experience, and I just want to normalize that for everybody. I so wish that I had a money tree in my backyard. I don't. But there are resources out there, and there's lots of avenues that our kids need services. They need equipment. They may need diapers past the point that would be a typically developing child. There's all sorts of things that they may need. So what I hope you're going to leave today is have an understanding that there's a wide variety of resources that are out there. You just have to know what to apply for. All right. So for Katie Beckett, what's the eligibility criteria? Under 18, federal guidelines for disability. They have to meet an institutional level of care. We are going to discuss what that means in detail. The cost for services has to be cost effective, and it cannot exceed the cost for the appropriate institutional level of care. They need to be either a U.S. citizen or show proof of naturalization. In the past, it's also been that you could be a permanent green card holder for 5 years. I've heard in the past week that that may have been waived. So I tried to get clarification from the state. If anybody knows if that indeed has been waived, that would be wonderful for a lot of individuals. So I'm not quite sure on that requirement right now. Kids who are at risk are not eligible. So we're talking about what are their needs on that day of the application. And you have to be ineligible, as I said, for Social Security. So meaning the income and the assets of the parents have to be above those SSI limits. You also need to be careful about what money the kiddo has in their name. So I've had several families who are like, I'm going to open up a Roth IRA account for my child, and I've got $10,000 in it. Okay. I need to refer you to a special needs trust attorney, and you need to get that resolved before you can go ahead and open up that and apply for Medicaid. Because money in their name, unless they're in certain types of accounts, will prohibit them from having any type of Medicaid. So who might want to apply? any child with a disability, even if they don't meet the criteria, because there's other benefits that you can have access to. It's totally okay to apply if you have Peach Care, AmeriGroup, or other types of Medicaid. And your child may have a condition that requires therapy or nursing care or frequent hospitalizations. It's a lot easier to have Medicaid if your primary is not an HMO. Why is that? Well, if you have an HMO, you need to go in network for your primary insurance policy as the HMO. And then with Medicaid, you have to find a Medicaid provider. So you have to find somebody who accepts both of them. Okay. With a PPO or a point of service plan, you have both in and out of network benefits. So it doesn't matter if they accept your primary insurance as long as they accept Medicaid. So it gives you a little bit more flexibility. You have to be seen by Medicaid providers in order for it to pay. So you just can't go to somebody like if you had a PPO plan and submit it and get some out of network benefits. It doesn't work like that. The doctors who order the services, typically your pediatrician who's maybe ordering speech or OT or PT or ABA, they have to either be a Medicaid provider or what they call an OPR provider, authorized to order, prescribe, or refer. So what does it pay for? So generally speaking, it works like insurance. So it can pay for deductibles, co-pays, co-insurances, prescription drugs. Kid falls and goes to the hospital and breaks their arm. No, it's not related to their autism, but that can be paid for as well. There's laws called Early Periodic Screening and Diagnostic Treatment, EPSDT. That's what covers Medicaid. We've made a lot of progress in the years, right? When my kiddo was growing up, ABA wasn't paid for. Now it is. So I know a lot of families want to apply for Katie Beckett because, frankly, of the high costs of getting those services done. Evaluations have to be done by approved private providers in order to get Medicaid to pay for ABA. So there's two different thresholds here. One is you have to have testing that's going to get you accepted into Katie Beckett Medicaid. That can be done by the school system. It can be done by Babies Can't Wait. It can be done by a psychologist, all of that good stuff. But if all you have is that school system evaluation, let's say, and then you get Katie Beckett and you're like, great, now I'm ready for ABA, can't do it. They won't use it. They won't accept it. So for ABA, they have their own manual, and you'll see there's certain providers that it has to be done by. And unfortunately, it's not via the school system. It's a diagnostic manual, and there's certain tests that have to be done with that as well. Where to start? So you can apply for Medicaid on Gateway. Everybody asks me all the time, Debbie, should I do that? You can. A little somebody told me we don't really necessarily advise it. It often gets routed to the wrong office and not to the Katie Beckett unit. If you apply, it's not going to give you all of the required forms. Some people end up doing that and then just waiting months. You can call their office to get an application. They have just come out with updated applications, and I've also posted all of them on my website on the free resources page. So you can 100% download all of the paperwork that you need there. And it's also on the georgia.gov site. But again, not all of the forms are currently on the website. Lots of different forms. I've listed them all here. I'm not going to go through all of them at this moment. You need, when you're applying, therapy notes, school and private. A lot of people don't realize that. That gets their applications hung up, and they have to be signed with the credentials of the therapist. Well, what happens in the middle of the summer and you're trying to apply and your kid gets speech 3 times a week at school? It's hard to get those notes, so you need to get them before school lets out. What happens if the school says, I'm sorry, but we're not required to give you notes? We don't do notes. True. but they will have a therapy log because they're required to keep track of how often they see it. So ask for their therapy log and ask for it to be signed with their credentials. If they won't, you need to provide an explanation why. Big hang up for a lot of people. On an initial application, they also need the last 12 months of records. Super, super, super important. All of your records for the last 12 months. What happens if your child went for a minimal checkup with your dentist? Don't worry about it, right? But do they want your pediatrician records? Yes. What happens if you only went once for a well visit? Well, in that well visit, it would likely be documented that your child has autism. They're looking for this information on your child. Discharge records for the last 12 months. Everybody messes up on this one. It's not the piece of paper that they hand you that says hospital discharge when you're walking out of the hospital. It's what you can get on My Chart. It's through medical records, and it talks about the admission date, what happened, and a discharge summary. And so there is a different discharge summary that you can get through the medical records. You need all of that for the last 12 months. Any nursing notes in the last 12 months, Social Security card, birth certificate. If they have an IEP, meaning they're 3 or older and currently receiving services, not you got one, but you have them in private school now. If they're receiving services, you have to provide that IEP. Or an IFSP. If they're under 3, that's the document you get from Babies Can't Wait. You'll need to provide that as well. You also, the most important piece for children on the autism spectrum is that developmental assessment or psychological evaluation. It has to be current. It has to have a signature and credentials. There's all sorts of requirements of what happens with that testing. These are the diagnoses that you're going to typically see for kiddos who are going to be applying under this ICFID level of care. So pretty much anybody who has a developmental delay. Okay. What's the difference between a developmental assessment and a psychological evaluation? So a developmental assessment is developmental testing in 5 main domain areas. Child is 0 to 5 years of age. A psychological evaluation includes children from 6 to 18 years of age. Testing scores are needed versus a summary. I see lots of problems with reports. It's not uncommon. Or just yesterday, I saw a report, and it was, they did an adaptive test, which is required on the psychological evaluation. And so it was listed at the top that it was done, but none of the results were in the body of the report. It was just left out. Things happen. People are human. So you need to make sure that you have all of the proper and required components when you're doing this. Testing has to be current and age appropriate for the child at the time of the application. Current is considered 3 years old. So a child is 9 who had a psych at 6. If they're applying, if it's outside of that 3 years of age, you can't use it. They're going to need to get an updated assessment. We talked about the IEP, right? So this is for kids who are currently receiving services. Don't give them a draft. Has to be the current school year. These are kind of the common things that I see wrong. You don't need a private school IEP. Oftentimes I'll see private schools write IEPs. That's not a document that you need to submit. The IFSP, as we talked about earlier, this is the document through Babies Can't Wait. It's birth to age 3. And again, it should be the current date. What do most people send me when I ask for an IFSP? I get their initial eligibility documents and signatures and costs that they're going to have to be paying for the program, but it's not the IFSP. So the IFSP talks about what services is the child receiving. So it's the actual plan, and we'll talk about how many minutes is the child receiving those services. Where are these things sent to? This is a great slide to take a picture of if you want. This is the Katie Beckett office. That's their phone number. Their fax is kind of on and off. Last couple of weeks, I heard it's been off. And the Gateway website as well. 100% call them. You can ask them questions. It has been difficult to reach them. That's been a common thing that I've heard from a lot of families. You do need to be diligent, leave a message. They will get back to you. And so you can contact them. They also have a drop box outside of their office as well. All right, so let's talk about the ICF ID level of care chart. So what are the requirements to be eligible under an ICF ID level of care? This is a lot of words, right? Let's first start with a child under the age of 6. So under the age of 6, they're looking for number B here. The child has a standard score of 70 or below, and it lists 3 of the 5 domains of function. Has to be cognitive, language, motor, social, emotional, and adaptive. So yesterday, I also had a conversation with somebody, and they didn't have all 5 domains. And it was listed fine motor and gross motor. And the parent was very upset because I was telling them, so sorry, you're going to need to get a new evaluation. She's like, no, this is fine motor and gross motor. This is 2 areas. I'm like, nope, those 2 combined is motor. So it's 5 areas. It has to be a 70 or below in 3 of the 5 domains, or their total or composite score is 70 or below. Now, I frequently see reports, particularly through the school system, Babies Can't Wait, that don't list that total. It might be called something like a general development index or another name. So if you don't have that total on yours, that might be another way you can qualify. It's not uncommon, particularly for a lot of kids on the autism spectrum, have one domain that really pulls that total below, but some of the other domains may be average. So getting that total could be a critical component in their application. Another way that kiddos based off of the ICF ID level of care could qualify is if their CARS is above a 37 or their GARS score is a 101 or greater. Now, you'll see on tests, there's raw scores or T-scores. Basically, the 37 and the 101 is for kiddos who fall within the range of a level 3 autism, so who have more significant needs. So don't get confused if you don't know what that score means. So that's one way for kids under the age of 6 to qualify. What about the kids who are 6 and over? Well, one of them is a full scale IQ of 70 or less. So that's one way that they could qualify. Another way that they could qualify is their adaptive functioning. So their adaptive functioning is part C. So it's 70 or below in 3 domains, or their total of 70 or below. So common adaptive functioning tests are things called like the ABAS. I see that quite frequently, or the Vineland. That's another common adaptive functioning test. Common developmental assessments. So for kiddos under the age of 5, DAC-2, Battelle Developmental Inventory, known as the BDI, Developmental Profile 4, DP4. Those are common names for developmental assessments. There's others that they accept as well. These are a few common ones, the Bailey. Child also could qualify based off of their level of autism. So for kids who are 6 and over, IQ could qualify them, their adaptive scores could qualify them, or they could qualify based off of their level of autism. Now, what happens if your scores are too high? 71 IQ, 71 adaptive, let's say you're level 2 autism, so you're not quite getting it on the CARS or the GARS. Could they still be eligible for Katie Beckett? Yes, they can, if they are receiving at least 5 therapies a week at the time of the application. So it's not that they need it, they have to be getting it. Do I encourage all of these families? Again, There may be some kids who may be testing near typical, right? But just maybe have a communication delay, and that's the only area that they're testing below. Should they still apply? Yes, because you can get what they call a level of care denial, and then you can access a grant called Champions for Children. They change it with the legislative session every year. Right now, it's worth around $2,700 a year. But think about 10 years, around $3,000. You're looking at $30,000 that you could use it for, speech therapy, for example. So I encourage families to apply. Who reviews your application? A company called Alliant. They're an independent subcontractor. They base levels of care versus hospital, nursing, and ICFID. And they have a review team. What happens when your application is approved? The Katie Beckett office gets notified of the approval. Depending on who your caseworker is, you may or may not get an email from them. Generally, that email has some really critically important information, meaning they'll tell you how long your level of care approval is good for. At a minimum, they're going to want to relook at all of this medical stuff every 2 years. And the maximum right now is every 3 years. So not everybody gets that email from their caseworker. You'll definitely get a letter in the mail and a certified letter as well. So what happens if you have an incomplete application? You may get an initial technical denial. You have 30 days to respond to them, and you need to make sure you apply. I have a lot of families who may go out of town for the summer and they're not checking their mail. I'm like, big problem, because then you're going to be denied. And once you lose that time period, you're not able to do it. When you get a final determination, you will either get a final approval determination from them, or sometimes people get a final denial. You do have rights to appeal. Again, you have 30 days in which you can appeal. You have to appeal to those time guidelines. There are agencies that can help you appeal for free if they're willing to take you on. Their letters will give you some of the options. Georgia Advocacy Office is one of those agencies right now. If you currently have Katie Beckett and you're denied and you want to maintain services, the only way you can do that is to appeal, and they will keep your Medicaid active. It can take long for them to do a hearing for appeal. I had somebody who just did an initial application and they were denied and were waiting for appeal, and it took about 6 months for them to get a hearing, and literally 2 days before the hearing, it was approved. So that's not uncommon. For the renewal process. So what happens? You get approved. This is wonderful. This is great news. What do? We have Gateway. Anybody here know Gateway? Do we love Gateway? I don't know. So there's two types of renewals for Katie Beckett. There's a basic renewal and a level of care renewal. Your basic renewal, as of right now, and I understand things may change in the future with changing of rules, you have to every single year give them your basic information to make sure you're not eligible for SSI. So your family's income and assets are above those SSI limits. And they're going to want to know your insurance information. So that happens once a year. If you recall earlier, I said level of care is approved for a period of either 2 or 3 years. We never know long how that's going to be. Super important for you to know when that level of care is going to be up, because you're going to need to make sure you have current testing. You need to make sure that you're going to be able to have access to your therapy notes. They're going to want to have the last 3 months of therapy notes, have a current IEP if you have one, all of those fun sort of things. So the basic renewals can be done entirely online on Gateway. I have been told by the Katie Beckett workers that sometimes, particularly if there's other family members who have other types of Medicaid, that it is not routed to the proper department. That's in particular where that happens. So let's say there's maybe some other kids who may be on AmeriGroup. It can be tricky. You can do it online on Gateway. Make sure you call and follow up with their office to ensure receipt. And again, that's done annually. You can do it via paper form. A lot of people just prefer it to be doing via paper form. Sometimes it can be tricky to change the information that they have in Gateway, like the income information or where you're working or that sort of thing. So a lot of people prefer to do it via paper. You can get the paper from their office. And again, I posted a copy of that basic renewal on my website and you can access it there. They're going to want to know a copy of income and assets, also if the child has access to them. So let's talk about this type of an account, a 529 plan. A lot of families I see open up 529 plans for their child. It's like a child savings, college savings plan. Who's the owner of the account? Oftentimes it's one of the parents or a grandparent, but the child is the beneficiary. That does not make them ineligible for Katie Beckett because the owner of the account is the adult. However, they still want to know about it. They need to know that it's there. I tell all these people to make sure you deal with an attorney who does estate planning to understand what are some of these ramifications. You need to take a look at the beneficiaries because what happens if maybe both parents pass, that money does go to the child, that can cause big problems with Medicaid benefits. So you need to have an understanding of any account that is kind of pointed to the child. There again is no doctor's forms, no therapy notes, no medical records that are needed for those basic renewals every single year. Now, the fun thing is, remember how I said basic is every year and then level of care is every 2 to 3 years? It used to be that they aligned, and many times they still do. But guess what? Now it doesn't. So not necessarily. So your dates may not always align. You may have a basic renewal due in January, and then your level of care may not be due until June. So a lot of people just get very confused on their dates. It is family's responsibility to keep track of when these are. Again, super important to communicate with your caseworker who approved your case initially. All right, so what are some pitfalls and reasons for denials? Well, yes.
You keep talking about a caseworker. So, where is that?
Yeah, so you get a caseworker for that application cycle. And then the next, by calling their office and finding out who is my caseworker, they will assign it to somebody.
Okay, because we've had Beckett for 4 years.
Yep.
But I don't, like, they keep telling me there's a caseworker, but they don't.
Right. So what happens is you've had Katie Beckett for 4 years. Let's walk through this. So somebody sends in their initial application. It is sent in. The Katie Beckett office receives it. Then it's assigned to a caseworker to process that application and send it to Alliant and communicate with the family about approval status. That is your assigned caseworker for that application cycle. Then it's time for your next annual renewal. The next one is going to be a basic renewal. It is not going to be assigned to a new caseworker until you actually get that paperwork into their office. So then it's sent, it gets into their office, then they're going to see who are they going to route it to. And again, the only way of finding out who that is to contact them.
You mean you contact
Katie Beckett office. Yep. They have a new phone system. So the last couple of weeks, I've been hearing some more noise about contacting them. I've also been told they're trying to get a generic email that goes to their office in general to allow for better communication. information. I know that they were granted some more caseworkers in the funding this year. Be patient with them, be diligent, keep levels of your documentation. A lot of people get very, very, very nervous because they send in their renewal paperwork and the date on Gateway says the application expires July 31st. And it's July 30th. They haven't heard anything. They're required to keep your Medicaid active while they're processing the applications. So don't panic. Even though that's what Gateway says, the left hand doesn't know the right hand. So I've had people, and it's 3 months after that until it's updated, and they may not get information. Lately, to be honest with you, I have heard of a lot of people, frankly, who have been dropped, right? That they've sent in their renewal paperwork and, their caseworker was backlogged and just didn't get it in by the termination date. If you contact their office, it typically takes them 3 to 5 business days to reactivate it, and they'll go back and pay any claims. I understand it can be problematic. It's not what's supposed to happen, but sometimes it does happen. All right. So where sometimes do we have problems with applications? Approved evaluators. Not having the application done by an evaluator who is approved and who is providing with the proper credentials. Many, many, many times I see, my occupational therapist did X, Y, and Z. Or my BCBA did X, Y, and Z. Nope, can't do it. Not going to be accepted. They're not on the approved evaluator list. So now, luckily, as Dr. Call said, pediatricians have been added and expanded to the list. It could be a psychiatrist, a developmental pediatrician, preschool diagnosticians. But again, they have to have their title. So most of the time when I'm seeing school reports, they're not putting their titles there. And if you send it into Katie Beckett, it'll get kicked back to you because they need to see that title and ensure that they have the proper credentials, and they're going to need to sign the report. So sometimes it's not done, but as long as sometimes evaluations are done by multidisciplinary teams. That's fine, as long as one of the providers who's signing it with their credentials and title is on the list, and they'll accept those. All right, so how do we fill out the Katie Beckett application? Well, watch my webinar. It's a 2.5-hour webinar. I will go through each and every single page of the application. What do you do? How do you fill it out? What is the information that you need? It's a lot. It's a lot. You can look at the source documents on GAMIS. So what is GAMIS? Well, GAMIS is a wonderful website that can be overwhelming to look at, but it's got some really good and critical information on there, such as their manuals. So they have a Katie Beckett manual. They also have an autism services manual. In there, you can see exactly what is required. They'll tell you the forms, they'll tell you the current approved evaluators, and we have the joy of having these manuals updated every 3 months. So it can be a rule-changing thing. So I'm constantly looking at GAMIS and seeing when are the rules changing and what do they mean. So what you may know today may be a little bit different next week. So we used to be looking at 3 levels of care. As I said, hospital, nursing, ICFID. Then their manuals removed hospital, and we were seeing nursing and ICFID. And now hospital has been added back in again. So these things can change. We just need to go by what's in their current manual. Understanding your testing of level of care requirements. So does the child's scores qualify them? Is it appropriate for their age? Is it done by an approved provider? Is the testing current? Is it signed? Does it include all of the required information? Developmental assessments, as I talked about earlier, for these kiddos under 5 are often not including that total score, and that is one of the ways that a lot of kiddos can qualify. So make sure everything's signed and dated. You need to. The doctor needs to. All of the notes, every single one, needs to be signed and dated. Will they take an electronic signature? So let's talk about what an electronic signature is. It's a certified electronic signature. Okay, so as a part of a hospital system medical record, that's fine. As a part of a clinic note that says electronically signed by so-and-so, that's fine. Is it a Word document that somebody typed their name in cursive? Not okay. Okay. So I see that happen a lot from schools, frequently when they're kind of doing their therapy logs. That's not going to be accepted. Please keep specific orders for school and private in your application. It is required. So when your doctor is preparing the application, they have to do orders for school as well as private if they're going to be considering all of those services. So Johnny receives speech 3 times a week at school and twice a week privately. How is the order supposed to look? Speech therapy school 3 times a week at 30 minutes a session. Speech therapy private 2 times a week at 30 minutes a session. That's how the doctor needs to write the orders, not speech therapy. Not evaluate and treat. That's my favorite. Nope. Nope. So they're not going to accept that. It has to be specific. How many times a week? What is the length of the session? Keep copies. Please keep copies of exactly what you send them. Sometimes things go missing. Make sure when you're dating it, you're not waiting 2 months before you mail it in. They're not going to accept something that's dated from 2 months ago. So make sure that, you're doing it and then it's current. And have an expert review your application. Have somebody look it over. Make sure you're understanding these guidelines so you don't get caught up. Right? That's where some of the biggest problems and the headaches are. I've talked to families over and over and over again who they're like, Debbie, I've applied 5 times. Or another favorite is, I hear you can never be approved the first time you apply. I'm like, who told you that? They're like, well, all my friends, because everybody was denied. I'm like, oh, please have them watch my webinar. Please. It'll walk you through it. Understand it. Understand it. Have somebody help you. Have somebody who's a professional help you with it. It is critically important if your child's going to be getting the services. All right. So we talked about renewals, full level of care renewals. That's not that one that you do every year. This is the one that you do every 2 to 3 years. So typically, if the dates align, they'll tell you to renew on Gateway. You can go in, you can renew on Gateway. Depending on the information that you put in, that generally suffices for the 508 form that they have. They've also just recently updated that 508 form. I have a sample of that on my website too, filled out, because everybody's like, I don't know what to fill out. It's a lot of pages and I don't know what to do and how do we do this? So I have a sample there for you. And they also want a DMA 285, which is the insurance form. Then they're going to want to know several other questions and several other forms. I call it the Holy Grail, the DMA 6. So super important. This is what your doctor is filling out and signing. They're going to want to know the last 90 days of therapy notes. A current psych or a developmental assessment has to be included. The IEP or IFSP has to be included. They're going to want to know the cost effectiveness form. Remember how I talked about it has to be cost effective to receive care at home versus an institution? So if you put on there that it's going to cost your child $100,000 a month to receive services, they're going to say your child is denied for Katie Beckett because it's not cost effective. It would be more cost effective if they were in an institution. So the manual has all of those dollar amounts, and they change them, right? And so understand what those dollar amounts are. All right, so you're approved. What do we do now? There's other funding options. So if you get Medicaid, Katie Beckett, or have any other form of Medicaid and you have an employer-sponsored health insurance, a lot of people don't know about this, but there's a program called HIP where you could very well be reimbursed for the cost of your family's health insurance premiums. You can send in the first part of that application with your initial application with Katie Beckett. Your caseworker is supposed to forward it to the HIP office, and then they're supposed to give you like a second form to fill out and additional information. If you're not approved for the HIP program, you can apply for a program called CHIPRA. And again, it has to be an employer-sponsored health insurance, so not one that you're getting off of the marketplace. It has to be, portion paid by the employer. With CHIPRA, it depends on how the plan is written, but it's typically they'll pay the employee child, so not as much as the whole family. I encourage everybody who has Medicaid, who has an employer-sponsored plan, to be able to apply for this. A lot of people ask me, is COBRA eligible? Yes, because it was still an employer-sponsored plan. Champions for Children. I talked about this. The only way you can get that grant through Easter Seals for Champions for Children is to get a level of care denial. Not a technical denial saying you didn't send in all required information, but a level of care denial saying your child doesn't meet the level of care criteria for an institutional level of care for Katie Beckett. With that, you can apply for Champions. It's up to 18. You can live at home, have a physical, cognitive, developmental, or medical disability. And right now it's around $2,700 a year. You do have to renew it every year. Super simple form to fill out. It's like a page and a half. It's not that big of a deal. All right. Family support funding. Anybody who has a child with a developmental disability, regardless of if you have Medicaid, who are not currently receiving supports through the Now Comp waiver, would be eligible to apply for family support funding. What is it? It'll pay for services like respite, family, education. Most people use it for social and recreational camps, things that are not covered by insurance. So somebody asked earlier about music therapy, right? A lot of kids love it. They think it's fantastic. It's a great thing for them. It's not covered by insurance. Family support funding can pay for that. The dollar amount that you get is based off of the state budget. Right now, it's up to $3,000 a family. Depending on your region, it might be different. They do have intensive family supports as well, so it can go up from there. A tip for applying. Make sure that they have funding before you apply. Most family support providers have a fiscal year starting July 1st. So most of them, not all of them, have money right now. But that's a question you want to ask. Do you have funds? You don't want to apply for somebody who doesn't have funds, because then you're stuck, right, of an agency that doesn't have funds. So when you go on DBHDD's website, they will give you a list of family support providers for each county. And so make sure that they have money. And if you want respite funding, find out as well with that provider if they're also doing respite. Not all of them do. And make sure that they're doing the category of services that you're looking for. So somebody, for example, I know wanted to do like a home modification. Not every family support agency will participate in every category of service. So it's important to know what you're applying for and if they're able to offer it for it. So what do we do if there's a kiddo and you need immediate access? not wanting to call 911, there's Georgia Crisis and Access Line. It's a 24/7 line. They're trained. They can provide you with referral sources as well, and they will come out to your home to help de-escalate the matter. I've heard a lot of mixed responses from a lot of people. If your child is in crisis and you need to call them, it's an important step. Okay, some of these reasons in terms of some of this documentation is making sure people are aware of what's going on. More often than not, I speak with families who are living isolated, right? Not going anywhere, not doing anything, and are frankly feeling a huge amount of shame. Like this shame, particularly if their child is having behaviors. I had a Facebook memory that popped up from like many years ago that just happened this week. And I was literally scolded by a woman in a grocery store because my kiddo was in the middle of a meltdown. And she's like, "How dare you allow that to happen?" And I said, "Oh, please help me. You need to write a book. Because if your child never did this and you know how to manage every single child, I can help make you famous." Okay? It's shameful. I have close friends whose kiddos have significant disabilities, and when behavior is impacting them, their world becomes smaller and smaller and smaller and smaller. They're kicked out of camps. They're not invited to parties. You can't go to a day program because they're not willing to accept you because of those behaviors, okay? So get those needs documented. Partly, it will help in terms of looking at your application for now and comp waiver. This is often the times most granted after kids age out of school. Can kids under the age of 22 get now comp? Yes, absolutely. They 100% can. There's some other waivers as well. GAP is up to 21. Kids who have medical problems and conditions. What I find is that kids who have GAP will transition over to now and comp more easily and more quickly. I also find that if you're using your family support funding, it's looked at. People are looking at this. Why would they want to give you now and comp, which let's say is, $20,000 for a now funded waiver, if you're not utilizing the $3,000 in family supports, right? So use what is available for you. So now is for individuals receive under 47 a year. Comp is basically a different dollar amount above. There's some difference in services. Unfortunately, services end for our kids oftentimes after adults. So there can be some limited adult physical and occupational therapy services, behavioral services, helping you get out and about into the community, right? Going to a day program, assistance at home. These are the sorts of services that are on the now and comp waiver. You apply via your region. So Georgia's divided into all sorts of different regions. So you find your county and you say, okay, what region am I in? And then I have another slide of listing the counties if you're not quite sure what your county looks like. And then you can call. But all of these forms are online. It is so super simple to fill out the application. Do you know how many people I know who don't fill out the application? It is easy. It's a page and a half. Name, address, phone number, social security number, date of birth. They want an IEP. They want your psych eval because there's requirements in terms of being eligible. And then they want to know what services your kid needs. It literally shouldn't take any more than 30 minutes to fill this out. Let the state know that you're needed, but make sure that if you're applying, you're providing them with the required information and take a look at what the eligibility requirements are. So one more resource. I'm very proud of this resource. I have worked many years on it. It's called Navigating the Maze. Over 40 pages of various funding and grant opportunities. So there are things like wish organizations, sensory-friendly movies, all sorts of things. Again, this is a free resource page. Please do it. Please apply. Go through it. Print it out. I had one family who had more than one child, and like Debbie, I literally, this was my new part-time job, and I went through that maze, which is literally navigating the maze, and I applied, and they were able to get over $15,000 in benefits from various funding and grants. So there's lots of information in there. There's links to Now and Comp. There's links to family support. There's links to the Katie Beckett website and mine and applications. There's links to special needs scholarships. So all sorts of categories. Please go ahead and do that. My screen is... Pardon me?
Miss Debbie, I have a question.
Yes.
Okay, so we was talking about the now comp waiver.
Yep.
For educators, when do you think that we need to start advising the now comp waiver to parents? Would you say like middle school, going 8th grade transition into high school?
Yeah, so sure. So you can tell families to advise as soon as they have IQ testing, adaptive testing, and autism rating scales that are going to show that they're going to be eligible for Now and Comp. So it can be literally as young as 6 in some instances. Are they going to fund a 6-year-old? Not now, not nowadays. Like, I'm not saying that. Do I know some middle schoolers who've had some significant issues get funded? Yes. And how do they look at it? So they've changed the way in terms of they looked at it in terms of our planning list. And so they're looking at it based off of the needs of an individual, right? So many needs are naturally met when you're in school. Right? So there's services, there's speech and OT, and there's maybe some behavioral support. And those services drop off when you're out of school, right? So that's a level of need, but there might be other level of needs. There might be a family dynamic. I know somebody that was funded when the child had significant disabilities, nonverbal, dangerous behaviors, and the father was diagnosed with pancreatic cancer, right? They were funded, right? It really needed a two-member household to be able to help and support them. So as soon as they have that, there's no reason. And every single year from the state, you'll get a call and they'll update your needs. And they talk to you, what are your needs? And so every year you get that interview and you talk to them and you tell them, where are your needs? So
Ms. Debbie.
Yes.
So is there any truth to the waiting list that, that we always keep hearing about,
Yeah, it's years. Yeah. My son was on it since he was little, and, he's 23 and is just getting funded. So for sure.
Ooh. Oh, thank you.
Yeah. So thank you all. It was a pleasure coming today. As I said, it was a lot. There's a ton of information on my website. I encourage everybody to go there. But please look at the resources. Know that they're out there for you. Thank you.